Welcome to Infection Control and Tissue Viability Training, created by EDS. You'll need a notepad and a pen, some concentration, and a place you can listen well. So, infection control. What makes effective hand washing? Washing your hands with soap and water and following the 7 or 8 steps of hand washing technique is really important. You want to make sure you get soap and water all over all parts of your hands, front and back, and your wrists, including your thumbs, and dry your hands, ideally on disposable towels or tissues. Benefits to antibacterial and non-antibacterial soap are minimal. Antibacterial soap is really good generally for bacterial problems, so in the kitchen, things like that, it's great. Generally, day-to-day hand washing, normal soap is absolutely fine. A good example to draw on here is COVID-19 and the pandemic. Antibacterial products make little difference. COVID-19 is a virus. It's not a bacterial-based infection. Alcohol itself is brilliant as long as it's over 70% alcohol content. The ones you get from Superdrug and the places where they smell lovely and look pretty often don't have an effective alcohol content within them. Alcohol alone is effective for cleaning your hands if it goes everywhere and if it's allowed to dry. My advice would always be soap and water as a first, dry your hands effectively, and alcohol as a second option if you've got no access to running water and soap. Good infection control basically means preventing the spread of infections. So when we're coughing or sneezing, we've got skin infections, we're handling dirty laundry, we're looking after unwell clients, it's all about trying to keep everything as contained and as clean as possible. A lot of this comes down to common sense. So as we've already said, the first thing you can do to make sure your infection control is really prioritised is good hand hygiene. Good respiratory hygiene. So if you're blowing your nose, you're coughing into a tissue, put it into a toilet, flush it away, or into a lined bin. We don't keep dirty tissues in our pockets. Effective use of PPE goes without saying. Anything within our PPE policy at EAM Domiciliary Service absolutely has to be abided by. It is there for a reason, to keep your client safe and to keep yourself safe. Disposing of PPE, pads and tissues, soiled laundry is as important as making sure you use all of these things effectively. So tissues, as we say, go into a toilet, PPE goes into a lined bin, pads go into a lined bin, soiled laundry goes directly into a washing machine. It doesn't join other laundry in an open laundry basket. It goes straight into the machine. When we've got waste products that we don't need anymore and have a possible carry of infection, they go right where they need to go. We don't keep them anywhere else. That encourages infections to spread. So what does effective PPE mean? Wearing the required PPE stated by the branch office. Applying the PPE after you enter the client's home and after washing your hands with soap and water. Removing the PPE after the care call is completed and disposing of this in a lined bin within the client's property. And, without saying this goes, not undertaking any cares without PPE. If the use of PPE has been stipulated, then it absolutely needs to be abided by. Why do we apply our PPE once we're in the client's home? There could be any transfer infection on the outside of that client's door. So you come from your car into a client's property, you go straight for the sink, wash your hands, dry your hands, apply your PPE, commence your care call. When you finish your care call, you do the reverse. The last place you visit is the sink, you take all your PPE off and place in the lined bin, you wash your hands, you dry your hands, and you depart the client's property. Advice secondary to that would be to then use alcohol or some similar product on entering your own car after you've left the client's property. We provide all PPE and alcohol or alcohol use waters for all of our care work at EDS. Our clients are at greater risk of contracting infections because they're frail. When people are frail and they're elderly, they have a reduced chance of healing. They are more likely to be in ill health, so have more frequent hospital admissions, and their diet and hydration status is less. Their consumption is less, and the options of hygienic preparation and storage is minimised, leaving our clients at greater risk of infection. So our duty of care as carers is simple. It's to keep our clients and each other safe and well by implementing good infection control measures. Again, these really are surrounded all by common sense. You use clean hands to do any task. You're taking spare gloves with you, so if you have provided personal care and you're going on to meal preparation tasks as an example, you change your gloves in between those two tasks. We do not carry on in dirty gloves, we swap to clean gloves. It's very, very straightforward. Infection control links to pressure area care. Pressure area care is really vital, specifically in our client range, because for reasons we've already discussed, they are additionally vulnerable. They also move much less, so there's more chance of pooling of the blood on heavy dense tissues. That is what encourages skin to break down. When that blood can't flow nicely and freely through the tissues, it sits, it pools, and if we sit there for too long and those areas get hot and they get sweaty, they break down and they continue to break down, and that is what creates a pressure sore. There are different grades of pressure sores, but every single one of them is a problem. A pressure sore is described as an injury to the skin and underlying tissues caused by pressure placed directly onto the skin. Pressure sores can easily break down further, and they can break down really quickly. So it's really important to maintain good infection control when providing care around pressure sores, because they link directly into the body's tissues. Everybody, technically, is at risk of developing a pressure sore if we don't move much. They usually develop around the places where pressure is received on the body, so hips, buttocks, base of the spine, which is often referred to as the sacrum, heels, ankles and shoulders, usually areas of some bony prominence. Pressure sores, as we say, develop when somebody stays sat or lay in the same position for too long and the tissue doesn't get that opportunity to perfuse. When we encourage people to stand, when we roll and turn people for personal care, that provides pressure relief, and it's really, really important. Pressure areas go in stage 1 to 4, 1 being minimal, 4 being horrendously dramatic. They start red, pink, purple marks that don't disappear after a few hours on the surface of the skin. It could be a break or a tear in the skin, which is likely to be graded as a 2. The skin can bleed, ooze, and it can have an unpleasant odour. However, it can be really sore or really completely painless and no odour to the oozing that comes from the wound. They can be the size of a pea or the size of a dinner plate, but as you can see, it affects the tissues very, very quickly. It goes from the first layer of skin into the second very fast, down to your third, where it's even reaching your layers of fat, and your soft tissues on your bone is where we reach stage 4 of your pressure areas. It sounds dramatic, but it can go from a 1 to a 4 in under a week with really ineffective pressure area care. So our duty of care as carers is vital that we check pressure areas at each visit when personal care is being provided. If you're washing a client, you're going to need your eyes to see where you're washing, assess that skin visually as you go along. You can even ask the client if they feel sore anywhere or if they've got any trouble with their skin. Promote and enable regular pressure relief, encourage standing, encourage turning, encourage just lifting up arms or ankles if somebody is laying in bed. Ensure skin is clean, but more importantly than clean, it's dry. Moisture is a real negative element to pressure areas. The skin needs to be dry. Ensuring that any concerns are flagged up to the office immediately is vitally important, and following any risk assessments or action plans that have then been put in place. Document always that your pressure area care has been given, or if it has been refused. It is so important to always document effectively everything that you're doing and everything that you're offering to do to your clients. Treating pressure sores are tricky depending on what stage they're at. Regular pressure relief given is a key. Following the action plans will always include giving pressure relief, and it will often link to community nursing teams as well. There may be dressings in place, different creams, different turning charts, different plans. We encourage everybody to follow these as closely as possible to give the client's skin the best opportunity to recover, to heal and to regrow. So when you call the office or the on-call and you say there's an issue with somebody's pressure areas, we contact the community nursing team and other therapies where appropriate. We also let the family know, so it's really important that we have all the information we possibly can to make sure that's a nice transparent conversation. What we do as standards and what we will request you to do is take photographs of these pressure areas of concern and send them into the office via email. We request you do this on your work phone, which has data given to that phone in order to enable that to happen. As routine, you will find with new clients, if we're receiving hospital discharges or clients are returning home from other areas, but they're usually quite still, we will be requesting photographs of shoulders, sacrum and heels as standard. This is so we can make sure we're assessing pressure areas really well, keeping an eye on them and trying to prevent them ever becoming a problem for any client. They are something that can be easily avoidable and we're very passionate about avoiding them. So a recap of this session, it is always so important to wash and dry your hands. Wash them with soap and water and dry them with disposable towels and tissues wherever possible. Absolutely always wear your PPE when you're instructed to do so. Always remove your PPE and dispose of appropriately in a lined bin within the client's home. Any queries or worries surrounding PPE, please contact the office before you commence any care. It is not advisable to complete any care without wearing the stipulated PPE. Emergency situations obviously stand alone here, but these are very rare and still consent should be gained from the office or the on-call if you can proceed without your PPE. Regarding pressure areas, please always monitor skin and just be vigilant when you're providing your care and say what you see. Always say what you see and report back to the office. Any concerns, big or small, are always really welcome. You being vigilant and you using your common sense surrounding infection control really does help to maximise the quality of life of your clients, and it keeps them at home because it keeps them well, it keeps them out of hospital.